The death of a child has been described as the worst loss that anybody can go through, and I think that's particularly true in the families that I've worked with.
I can't imagine life without him. It's hard, but yeah, we're just doing what we do, and he's a little fighter. We're excited to find out we were having a boy.
Yep.
Because we had a girl. It didn't matter either way, but I think because we named him after Dave's dad.
He was the first grandson on the family side.
There was only really 18 months between them, so she was a perfect baby, like textbook, everything. And then when we came home from the hospital, I had a screaming newborn that screamed all day, all night. And because what I had experienced with her, I knew something was wrong.
He was always sick, always like had chest infections, ear infections. He was just always sick, always on antibiotics, and yeah.
It's like you think that a baby shouldn't really be on
Yeah,
antibiotics
like
every 2 weeks.
Just knew there was something wrong.
Yeah. And I think it's until you see the right doctor and or the right people that you sort of don't move forward. I felt like I was seeing one doctor and it was just the same thing, that it's just reflux, it will go away, he will get better, and it's not a genetic condition. We tried everything, we didn't give up. We just thought there's something wrong, we have to find out. In a way, I'm glad we know what the diagnosis is, and that we were told about it, not living every day that we still don't know what's wrong with him.
Charlie has a gangliosidosis, and that is a storage disorder, and it affects the nerves, resulting in Charlie being physically impaired and also cognitively impaired.
I still remember the day. We were in this white room and they just said, your son has GM1 gangliosidosis, there's no cure, and he will die. And I just remember crying in the room.
That was a very distressing time for his parents, to realise that this was going to be a progressive condition from which Charlie would die.
I think it took us probably a couple of weeks to let it sink in, because I don't think we really wanted to believe it. Yeah. One day we were in hospital and he was down to, I think, 8 kilos.
Yeah.
Dr. Ellaway came in and said, you know, he looks pretty bad, you know, I don't think he's going to make it through the night. I think it really hit us then that, wow, this is serious, you know, and we sort of, you know, told all our family, you know, you better come and say goodbye, and, you know, it was a really hard night because we hadn't had time to accept all of this, you know, and he pulled through.
He was first referred to palliative care approximately 3 years ago when the diagnosis was made.
I still remember meeting the palliative team the first time.
The very word palliative care can raise all sorts of anxieties in families because they associated that with terminal care, in other words, the last few days of life.
He was in hospital at that time, and when they introduced themselves, I just thought, you know, why would we need a social worker, or why would we need, you know, a nurse?
Many families can have or express fear when they first meet the palliative care service, and the reason for that is their understanding of palliative care, which might be along the lines of palliative care is only involved when a person is in the last hours or even days of life. The truth of the matter is palliative care would consider terminal care to be just a small component of what they do.
A lot of our role as a palliative care service was providing them with information and support, giving them an opportunity to ask questions and go over information that they'd received and do a little bit of planning for Charlie's life and for his comfort.
The palliative team, they've always been there for us. They've always helped us. They're always telling us if we need more help to let them know.
In our team we have medical doctors, we have a clinical nurse consultant, we have a volunteer coordinator, and we have administrative support.
It does help once you get your head around the whole diagnosis, and then who is actually there to help you through just the day-to-day things, because you really have to just pick up and just sort of look after this child that needs you so much.
Initially, very little was needed of the palliative care service at the outset, but with time, Charlie has now become more symptomatic. So we've had to be much more involved in his care, managing his symptoms, which consist of his secretions, his pain, and also his seizures.
As each year goes by, you can notice
Changes.
I think now his vision is probably almost gone.
Yep.
And his back as well is curving more. But then, we were told about that. So,
really, we just take it day by day. That's all we can really do.
Yeah.
Charlie's parents were told when he was diagnosed that he would live to about age 3. He's now age 4. So that's brought with it its own complications. But I guess going back to the beginning, it was the diagnosis was a complete shock. Charlie's family, as with most of the families we see, have experienced a huge amount of anticipatory grief. Anticipatory grief is when you know that a loss is coming and you start to grieve before it comes.
So what's important is opening up the discussions and discussing with the family where they want to be.
The important thing for people to know about end of life for their child is that it can be decided by them. So the location of their choice, it can be either hospital, home or hospice.
We don't really talk about that time. I think Charlie would be more comfortable at home.
Yeah.
It's not really about us. I think he knows his bed, he knows his spot here, but I guess you don't really know until time comes.
The grief is not necessarily about his death, it's about all of those hopes and dreams that you have when you're planning your family and when you find out that you're pregnant, all of your dreams for your child.
When we had Ali, we were really excited, we were proud parents of Alicia. And and then when we decided to have another one, it was, we wanted them close, so Ali has somebody to play with, and
I think that's what's been the hardest
to grow up together.
Is sometimes she'll say, I have no one to play with. Alicia's going to be in year 1. She loves dancing, swimming. What else do you like? Going to school?
Going to school. And reading books to Charlie.
Siblings are incredibly important. So again, the role of our service would be caring for the siblings, helping them with some anticipation related to the death of the child, but in particular as well caring for the child afterwards.
The fine balance that often we support parents through is not getting stuck in your anticipatory grief to the detriment of your relationship with your child while they're still here. So talking to parents about it being normal to start grieving now and doing what they need to do in order to let that grief out, but then also being able to focus on their child and creating memories with their child. in the here and now.
I feel kind of blessed that he's in our lives because he's taught us a lot.
Yeah.
Like all we want him here.
Yeah.
That's, you know, he's our son, sick or not. We love him so much, and we're lucky to have him in our lives. We want to give him the best possible life he deserves, I think.